Welcome to the deep dive. I want to start today with a number from the sources that genuinely confused me. 1 to 4%.
The prevalence rate.
Right. If you believe the data, hidradenitis suppurativa, let's just stick with HS for sanity's sake, is incredibly common. For you listening, that's potentially millions of people. Yet, reading these articles, it feels like this massive blind spot in public health.
Yeah.
Why is something so common treated like a rare mystery?
Well, it's because it hides. And I mean that literally. HS is chronic inflammatory skin disease, but it targets areas people just don't want to talk about, areas rich in apocrine glands.
Like the armpits and the groin.
Exactly. Under the breasts, too. So the location drives the silence. And visually, it looks like other things. It's often mislabeled as acne and versix, which is really...
It makes it sound cosmetic.
Right. It does. It's a patient's a huge disservice. It makes it sound like just a bad breakout.
The sources were emphatic about that distinction, actually. They mentioned a diagnosis gap of 5 to 9 years. That is a staggering amount of time for you to suffer without answers.
It really is. And that delay happens because early HS is a chameleon. It mimics common boils or ingrown hairs or folliculitis, but the underlying mechanism is completely different.
This is where I needed you to clarify the biology. The notes mention something called follicular occlusion. In plain English, what is actually breaking inside the skin.
Okay, imagine a pipe blocked at the drain. That's a normal pimple. Now imagine a pipe that gets blocked, pressure builds up, and it bursts sideways underneath the floorboards.
Oh, wow.
Yeah, that is HS. The hair follicle clogs and ruptures deep within the dermis.
And that rupture triggers the immune system.
Like a massive explosion. You get this intense inflammatory response resulting in painful nodules and abscesses. But here's the kicker. Because the body tries to heal that underground damage, it forms scar tissue and tunnels called sinus tracts.
Tunnels.
Literally tunnels under the skin connecting the lesions. That's the absolute hallmark of the disease.
That sounds incredibly painful. And it leads me to a big myth we need to bust right now. Because it looks like boils, people just assume it's about hygiene, right? That you just need to watch more.
Which is completely false. The sources are categorical here. HS is not contagious, and it is absolutely not caused by being dirty.
Right.
It's auto-inflammatory. You can't scrub it away any more than you could scrub away rheumatoid arthritis.
Speaking of how it progresses, I saw doctors use something called Hurley staging. Is that a way to categorize the damage?
It's the standard severity ladder.
Yeah.
So stage 1 is just the abscesses, painful, but no tunnels yet. Stage 2 is where you start seeing those sinus tracts and the scarring.
And stage 3?
Stage 3 is diffuse involvement. The tunnels connect across an entire area, is very difficult to manage.
But looking at the research, the damage isn't just limited to the skin, is it? This was a real realization for me. The skin is just the dashboard for a bigger engine failure.
That's a fantastic way to put it. HS is increasingly viewed as a systemic disease. The inflammation you see on the surface is mirroring inflammation inside the body. It's tightly linked to metabolic syndrome, type 2 diabetes, and cardiovascular disease.
And depression, too. The sources highlighted that.
Huge link to depression, partially due to the severe impact on quality of life, but likely also due to the systemic inflammation affecting the brain. Genetics play a huge role, too. About 1/3 of patients have a family history of it.
There are risk factors mentioned as well. Smoking and obesity seem to be the big ones fueling that inflammation. But if you're dealing with this, what do you actually do? The treatment list looked pretty overwhelming.
It's a ladder, just like the staging. You start with lifestyle adjustments. Loose clothing to stop friction, and antiseptic watch like 4% chlorhexidine to prevent secondary infections. Then you move to medications.
The antibiotic protocol seemed heavy, like 12 weeks of doxycycline.
Or limcycline, yeah. It's necessary to calm that deeds inflammation. For severe cases, they often combine clindamycin and rifampicin. But there is a major snag there right now. You might have caught this in the July 2025 notes.
The shortage.
Exactly. A national shortage of rifampicin means doctors are having to scramble for alternatives. It's often pushing patients toward biologics sooner than planned.
These are biologics like adalimumab or secukinumab.
Right. They essentially hijack the immune system's signaling to turn off the inflammation at the source. But if the tunnels, those sinus tracts, are already there, the drugs can't always close them.
That's where the surgery comes in. De-roofing. It sounds pretty barbaric.
It sounds intense, but it provides so much relief. They surgically remove the roof of the tunnel so it can heal from the bottom up. It stops the cycle in that specific spot.
It's just a lot to process. The chronic pain, the potential surgeries, the systemic risks.
It impacts every single facet of a person's life.
So if we're summarizing this for you listening, we really need to stop thinking of HS as just a skin condition.
Absolutely.
Yeah.
If there's one takeaway, it's that HS presents alongside arthritis and heart risks. We have to view those skin lesions as a visible alarm bell for the body's entire health system.
It's a warning light that demands we look deeper, which actually leaves me with a final thought for you to chew on. If HS is this systemic alarm bell, what if early aggressive treatment of the skin doesn't just clear up the lesions? What if stopping that inflammation early is the key to preventing the heart disease and diabetes from ever developing in the first place? Definitely something to think about. Catch you next time.